name's Sarah. I'm a technician here at IndyVet that works in the ophthalmology department, and I just wanted to show you guys how to get some ointments in. So there's a couple different techniques you can do with ointments. Now Kinga here has been our volunteer. So I'm right-handed, so I'm going to hold the tube in my right hand. And you can actually use the tube, or you can use your finger, but we're going to use the tube here for this first round. So you want to try and get behind them so they can't back up. And what you're going to do is just make sure they're kind of snug up against you. You can also kind of use your arms even to help squeeze in if they're trying to wiggle side to side. So the other thing you're going to do is, I'm going to use my left hand because I'm holding the tube to my right, is if you can tilt the head up, it does help you get the ointments or drops in a little bit easier. So there's a little bony ridge up top here, right above the eye, that it's really safe to put pressure down on, so you can kind of use that as a reference point. And what you want to do is, you really don't need a lot of ointment when you use ointment, but it does always want to kind of seep out of the tube. So you want to get kind of just a little bit out of the tube, like 1/4 of an inch strip is really all you need. And then use that little bony reference point here to kind of put pressure down on, and it should lift that top eyelid up a little bit. And then if you can get that to tint a little bit, you can just kind of swoop it in, and then when she blinks, it'll disperse itself, so you don't have to worry about that. Good girl. The other technique you can do is to put a little bit on your finger, and so I'm just going to put like a little tiny bit that you want to be able to break it off the end and not actually touch the end of the tube, just not contaminate it. So, so you're going to use kind of those same reference points, so you can use it to okay, so we're going to go ahead and put you can use your thumb if that helps. You can use the back of your hand if that helps. You can even use the middle finger, which I think is the easiest to sometimes do if you have the ointment on your hand. So when you do that, it does create like a little bit of tint on the top of the eye there, and so you can swoop it right underneath that as well, and then when she blinks, it'll disperse itself too. So good girl, Kinga.